We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations.
The World Health Organization now says monkeypox is a public health emergency of international concern. The CDC reports there are nearly 3,000 confirmed monkeypox cases nationwide. Lawmakers are calling on the White House to step up its response. A group of 50 House Democrats wants the administration to declare a public health emergency in order to accelerate vaccine delivery. The Biden administration expects to release more than 1.6 million vaccine doses in the coming months. Now, the World Health Organization designation means we are in the midst of two official global health emergencies as COVID-19 continues to infect people in the U.S. and around the world. At Tops News 19 at 4, I'm Christine Killemeyer.
And I'm Jerry Hayes. That designation comes after reports of more than 16,000 cases of monkeypox in 70 countries. News 19 Chief Investigative Reporter Brian Lawson joining us now in the studio with more. And Brian, really with two emergency health concerns right now, sounds kind of ominous.
It does. I spoke to Dr. Wes Stubblefield of the Alabama Department of Public Health today about monkeypox and COVID. One thing that's worth remembering, the WHO designation is aimed at globally identifying and treating cases and keeping an eye on disease spread. But there's a big difference in the two viruses' status in Alabama. We're averaging around 2,200 COVID cases a day currently. There are only 5 reported monkeypox cases so far. What are the effects of COVID-19 and monkeypox?
COVID is still active in the community. There are well over 600 patients in the hospital statewide with COVID. And so it is affecting our hospitals, it's affecting our communities. And almost all of Alabama now is in the high community transmission status. The monkeypox has a very particular course. You come into contact with the virus. The virus has generally a 1 to 3 week, what we call incubation period.
Monkeypox symptoms include fever, muscle aches, then rash appears.
It can be very severe and uncomfortable in certain cases, particularly people that are immunosuppressed. But for most people, it's a mild illness and resolves without treatment.
What about a vaccine?
Essentially, anyone 6 months and up can get a COVID vaccine. There are very, very few exceptions, but that's the case. With the monkeypox vaccine, it's not recommended for everyone. It's recommended only for either people who handle laboratory specimen. They can get that as a pre-exposure dose, and then people that have had a known exposure to a suspected or confirmed monkeypox case who have not developed symptoms.
Treatment options are fewer with monkeypox.
This medication has a lot of potential side effects, and it's not for every patient. It's only for very limited patients. With COVID-19, we continue to have the same treatments, the Paxlovid, the oral treatment. There's IV treatments that are available. And the COVID, as opposed to monkeypox, COVID vaccination and treatments are widely available.
What about exposure risks?
COVID spreads very easily from one person to another. Monkeypox does not. Monkeypox really requires that close, intimate physical contact. And so, we will see cases, we'll probably see more, but it's not going to be, this explosion epidemic that we've seen with COVID.
Now, health officials say monkeypox cases have generally occurred from contact with a person's rash. That's generally been from sexual contact with men who've identified as gay or bisexual. But Dr. Stubblefield says there's also been cases from household contact.
All right, so Brian, monkeypox has been around for many years. Why is there concern about a global outbreak now?
Right, Dr. Stubblefield says that the data suggests it's a byproduct of globalization. People travel around the world and some viruses will follow, and it's been endemic that is found regularly in some parts of West and Central Africa, according to the WHO.